Hi guys, this is
me Gayatri Prakash and welcome to my page. എല്ലാവർക്കും എൻ്റെ പേജിലോട്ട് സ്വാഗതം. So today I would like to discuss with you all about visiting letter because um, we are recently having receiving so many letters which is like kind of a receiving letter visiting letters, like a community nurse is doing a multiple visit to the patient family and visiting a patient at home and writing a letter to the GP. So in that situation, how we can write a letter, like if a letter is coming up with the multiple visits, so how we can write the letter and which visit has to be written in the first and which visit has to be written in the second. So there are multiple confusions for the students who is preparing for their upcoming exams. So here I would like to give a clarity. So when you have a visiting letters, how you have to narrate that letter and how to write it in a letter format. Okay, so let's move on to that. For example, a nurse is visiting a patient at home as per GP's request, and she is making a multiple visit to the patient house, and at last she is writing a letter to the patient's GP when the patient is unable to manage at home and the patient needs immediate medical attention or further treatment and management or investigation. So in that situation, a nurse is writing a letter to a patient GP. It could be a district nurse or it could be a community nurse, it could be a like nurse who is from the locality. So she is the one can make a visit to the patient house as per GP's request, and then at last she will write a letter to a patient's GP to know about patient's condition for the GP. Okay, so in that situation, how the way we can write, which information has to be written first. So introduction, as we know that as usual, to make an introduction we need three things: patient full name and diagnosis, and then we need to write the purpose of the letter, why we are writing a letter to the patient. So if the visits, there are 5 visits for example, so in that situation, first we have to read the entire letter and we have to know, we have to check it that full 5 visits are related with one condition or not. For example, patient is having abdominal pain. Okay, so when the nurse is visiting as per the GP's request to the patient house and she is looking after the patient is complaining of abdominal pain, so that nurse is giving a conservative treatment at home itself with the GP's order. And then she's making a second visit, and the second visit also patient is having the same complaint, and the third visit also the same complaint, and the final visit also same complaint. So in that situation, rather than writing like during first visit, during second visit, during subsequent visits, during final visit, or during the last visit, today's visit, so instead of writing like that, when you have the complaint is same for all the visits, all the consecutive visits, if the patient is having same complaints, so better to narrate like this. So Mr. X has been under my home visit since this day during my visits. Better to write during my visits rather than writing during my first visit or second visit, so that you can, after the introduction, can better to start the present medical history paragraph like this if the complaints are same for all the consecutive visits. So how we can start: Mr. X has been under my home visit since this day, full stop. During my home visit, he was noticed to have so and so condition and he was treated with so and so this one, and still how the patient condition is. So which means this, all the 4 conditions, 4 visits can be written. The last visit you can make it as a separate paragraph, that you can during today's visit what was happened, because the previous visits, all the previous visits were treated by a nurse, but the last visit the nurse couldn't treat the patient at home, thereby she is writing a letter to a doctor or patient's own GP. So in that situation, the today's visit is very important that we have to highlight in our letter, and that has to be elaborated as much as possible if the reason is same for all the consecutive visits. Okay, so this is the way we have to write it. So when you are writing the today's visit, along with it, if it is any important thing to mention regarding the social background of the patient, for example, past medical history, medication history, dietary pattern or exercise programs, or any habits, so this all can be written along with the today's history. So first is introduction, second is you can write the if the reason is same for the consecutive visits, that all can be narrated in one passage, that is present medical history paragraph. And then next, you can write it along with the social background. So what was happened the last visit, which means the today's visit, the final visit, what happened. So because of that reason only, mainly we are writing this letter and we are referring the patient to the patient's GP or some other doctor. So there we can write it along with social background. When the social background writing, just pick the important information only. If you are writing for the patient's own GP, of course you no need to write the social background, you can skip the social background. In case if it is a new doctor that you are referring, thereby you better to add only the important information. For example, habits, past medical history with the relevant medications history, any family history of family medical history. These all things can be written in our social background along with the today's history. And then as usual that we are concluding the passage. Concluding a passage, of course here we won't ask the doctor to do any recommendations, because it is not a kind of a discharge letter. Thereby you can write just simply, it would be highly beneficial if you could take over Mr. So-and-so and do further investigation and management to treat his condition in a simple way. So your concern on his condition is immensely appreciated. So a very simple way, in a standard way, we can complete the recommendation paragraph. So this is when the condition is same for all the consecutive visits. The symptoms are, complaints are same, all the consecutive visits, means you can write it like this. For example, another way, so the nurse is making a visit, which is a 5 visits you keep. So during this 5 visits, each visit patient is giving a different complaints, not the same complaint. For example, the first visit patient complaining of headache, second visit patient complaining of abdominal pain, the third visit patient is complaining of like a general body weakness and pain and fever, and the final visit patient is having the chest pain. So in that situation, how you can write it? Which means here right after the introduction, it is very important for you to write the last visit, today's visit. Because of the today's visit, you are referring the patient to the doctor. It is because of the chest pain. So here the last visit is most important, that you are writing it in the second paragraph as a medical history paragraph. And then later you can't write it like patient like you had a 3 different occasions. So patient had a 3 different occasions, like what the visit you had. So during 3 different occasions, patient complains of abdominal pain, headache and fever, so that he was treated with the so and so things. So like that you can write it. So we have to understand first. So the visits first we are seeing. If there is a 5 visit, the 5 visits also with the same complaint, you can write it all the visits in one passage, and the last visit, today's visit, can be written it in the separate passage that you are highlighting, because the last visit we are unable to treat it. That's why we are referring the patient to the doctor. And another one is the 5 visits are different condition. Each visit patient is complaining different things, but the final visit is a major problem. That's why you are referring the patient, which means after the introduction, it is very important to write the today's visit first, and then you are writing the remaining visits rather than writing during my first visit, second visit, third visit, because it will increase the word count, and also you are involving unnecessary information in your letter. So we have to make sure with that. Either all the visits patient is complaining the same problem or different problems. So which is very major thing, the last visit always has to be highlighted. Because of that last visit only we are referring the patient to the doctor. The previous visits problems are managed by the nurse itself at home. Okay, so we have to understand this, and you can make the letter, and it is easy for you to narrating this different visit letters. Alright, so as we know that known case letter, which means skip the social background but write all the visits detailedly, but make sure that either it is the same complaint or different complaints. So as per the complaints, you have to give the priority rather than writing all the informations. Okay, and you can ask me each time whether we have to write the vital signs of the patient. No, it is not necessary. When it is like the vital parameters are really elevated, and especially you must to mention the vital parameters at the today's visit, like the last visit. Because of the last visit we are referring the patient, not because of the previous visits. Okay, so previous visit vital parameter is not necessary to elaborate it, like temperature, like the pulse, heart rate, like that. It is not necessary to mention it. But the today's visit, if the vital parameters are abnormal, it is mainly to highlight it in your writing. That is very important. Okay, I hope this discussion might be helped you for the people who is preparing for their upcoming OET exam. So just think and write. The visiting letters are a very simple letters if you understand the concept, and if you understand to whom we are writing, what is important information, rather than writing during first visit, second visit, third visit. Please better not to write like that. Okay, and whomever wants to join in our class, our number has given in our description. You can contact us anytime and you can join in our class. And until then, bye bye.